Good morning, good afternoon. Thank you everyone for joining us. No matter where you are joining from the world, we are so happy to have you here in the Zoom room with us today, and so delighted to be a part of the Law Enforcement and Public Health Conference. Thank you so much to Jennifer Wood and Temple University for hosting this incredible event and for creating an online experience that's as close to being together in person as possible. I'm delighted today to be on a panel with two wonderful colleagues, Harold Pollack and Marilyn Sinkowicz. And our title of our talk today is Evaluations of the Role of 911 in Optimizing Public Health and Safety in the United States, Evidence, Lessons, and Opportunities. We're going to spend a couple minutes talking about some work that we're doing. Each of us will share a little bit about some work, and then we will open it up to questions that folks may have. But first off, I'd just like to introduce myself and ask Marilyn and Harold to do the same. My name is Rebecca Newstetter. I'm currently serving as the Executive Director of the University of Chicago's Health Lab. Our work is directly at the intersection of health, safety, and justice. And I'm delighted to be here and pass it to Harold.
I'm Harold Pollack. I'm a public health researcher. I'm actually at the Crown Family School of Social Work Policy and Practice at the University of Chicago, and I'm co-faculty director of the University of Chicago Health Lab, and work closely with Rebecca and looking forward to our conversation with Rebecca and Marilyn today.
Thanks, Harold. Marilyn.
Thanks, Rebecca. I'm Marilyn Sinkowicz. I'm a psychiatric epidemiologist. I have an appointment at the University of Michigan Institute for Social Research and with the Vera Institute of Justice. And I'm really focused on health disparities and the social determinants of health disparities. And I'm very happy to be part of this panel today too.
Wonderful, thank you so much. And I believe that one of our colleagues, Cree Medley, may have just raised her hand. Cree, I'm having difficulty figuring out how to unmute you. So if you wouldn't mind entering into the chat bar or the Q&A if you had a question. And we invite everyone to please ask questions using either the Q&A or the chat bar functions. We are really excited to hear from you and to join in this conversation today after we thank you, Cree, for sharing. So we know that the Q&A bar is working, and please do raise your hand if at any point in time our audio cuts out or you have questions. We definitely want to make sure that the conversation is engaging today. So with that, I'm going to just spend a couple minutes laying the landscape here. And as we know, emergency crisis response all across the world really does define what public safety and public health looks like. In the United States, unfortunately, this has been a very neglected, underinvested system when we think about emergency crisis response generally and 911 specifically. So I spent several years working with a couple of jurisdictions and a handful of collaborators, including Marilyn and many other really fine researchers, in order to try to establish the landscape of what 911 looks like in the United States. And I will share a little bit of that today. Marilyn will share some outcomes of that study, and Harold will share with us some really exciting research that builds and takes this work in a whole other direction. So looking first at how we understand law enforcement through the lens of 911 call for service data. And I really want to impress upon the group today how important the 911 system is to our public safety and our health systems. However, as I mentioned before, this is a very neglected space. Importantly, however, 911 essentially dictates everything that happens in the criminal justice system. It has been very under-researched and underinvested in. And so what we know is that there are, lots of disparate pieces of information that we're trying to connect together in order to tell the story. And that means both the story in terms of how 911 operates across the country, but also in terms of any individual who may call 911 in a given moment, who's experiencing a crisis, has a need, and they are calling for some kind of service. And we often don't really have the tools in order to understand those needs at the macro and the micro level. The 911 system and call taking itself often represents a bit of the game of telephone, in which you tell a call taker something about your problem. That call taker enters that information into a system. It gets passed on to a dispatcher, and then it's decided if it's a police officer who will be responding to that call, a member of the fire department, emergency services, or whatnot. There are lots of different points throughout this process in which information gets lost or shared or transmitted. And sometimes that helps to solve the problem, but there are often instances in which information is left out, or there are transmission errors that create real challenges. And in the United States, we've seen that this has real life and death consequences. For example, an infamous, really tragic case in the United States is Tamir Rice, who was a 12-year-old boy playing in a playground near his home with a play gun. A 911 caller called this into the police, and at multiple points throughout the call said that it's probably a fake gun and it's probably a kid, but I think somebody should check it out. When you look at what was entered into the 911 system and the information that was actually translated and transmitted to the police officers, it was a gun call at a park. There was no ambiguity or skepticism that this might be a child playing with a toy. And we will never know the counterfactual of what could have happened in those circumstances. But I'd like to believe that if people had the right information at the right time, that Tamir Rice may have lived to see his 13th birthday. So when we think about this system, we think about policing in the United States more generally. And what we know is that there are upwards of 250, maybe even as many as 350 911 calls that are made every single year in the United States. We really don't have a clear sense as to what those calls are about, why people are calling the police, what kinds of things they need. But what we do know is that the vast majority of this time, of police time, is dictated by 911 calls. And so it really does establish how policing functions in most of our communities across the United States. But there are big gaps in knowledge, which we'll turn to shortly. But first, I just want to give a quick overview of 911 dispatch and the history of it in the United States. In the United States, we think about 911 as the system that's been around forever, where in fact it's only been around since 1968. It's been in place for less than 52 years in many parts of the country. It wasn't until 1999 that the United States Congress established 911 as the singular nation emergency calling number. But in that couple of decades, the system has started to play a really outsized role in how we define police response and needs within communities. We should not forget, however, that it was not benign, the development of 911 in the United States. And there were actually very racist origins that led to the creation of the 911 system. While countless lives have been saved through 911, the original impetus for developing this system in the United States came on the back of trying to control notions of disorder in Black communities across the United States, and in the wake of civil rights protests in 1968. This picture that you see before you is of the very first 911 call made in the United States. And the elderly gentleman that's sitting in the middle is an infamous American civil rights white supremacist by the name of Bull Connor, who was instrumental in putting 911 in place in the United States, as well as promoting violence and aggression against Black communities who were seeking to desegregate their communities. So thinking about that as the backdrop of 911 in the United States, we really need to be cautious as we think about how this system is operating in our communities every single day. I'll share now just a few sort of brief notes about a mixed methods multi-city study that Marilyn and I and a number of others were involved in. I'm very thankful to the Camden County Police Department and Public Safety Communications Division, as well as the Tucson, Arizona Public Safety Communications and Police Departments for allowing this research to occur. What we did is we tried to review all of the literature as it relates to 911 and policing in the United States. We created an opportunity in order to map what 911 call taking actually looks like. We analyzed the computer-aided dispatch data or the 911 records, and then we also matched that to the outcome. So what actually happens when the police respond? And Marilyn will focus on that last 4 box. But essentially, we tried to use this multi-city analysis in order to cast a landscape of what's happening nationally, because we're lacking national statistics and investments in this area. So the first thing to share with you today is that 911 call taking is not a linear process. It's quite complex and it can be quite circular. Calls may come in from multiple parties around the same incident. The same individual may call multiple times. It does have a very cyclical feature, and it makes it very complex in order to understand what the needs are over time, as well as in any given instance. But what we were able to tell from our research, which really sort of complements anecdotal data that we've heard all across the country, is that the vast majority of 911 calls do not result from a crime in progress or a serious violent interaction. The vast majority of calls have to do with things that are much more order maintenance kinds of calls, like disturbance of the peace, disorders, checking the premises, suspicion, things of that nature. What we see is that there's also a clustering of calls towards the end of the week in most jurisdictions, and towards the end of the day. Although it's important to highlight that while this is happening most frequently at the end of the day, it's not most frequently occurring in the middle of the night, in which the police are often the only responders that we can rely on to come into communities when there are challenges. And so when we look at the call volumes by incident type in just one of our agencies and trying to put this back to the public health perspective, what we see is that there's a very small number of calls that on the surface are obviously mental health or physical health or developmental disability related kinds of requests. Although we understand that there are probably much more nuanced ways in which these health considerations come into play. And Harold will speak about that and is doing a wonderful job of exploring this in his research. But on the surface, it's often, less than a few percentage points of the total 911 call volume that has to do with the discrete health question or need. And similarly, we saw that in the second agency that we looked at. Although the statistics were slightly higher, it's still only a few percentage points of the calls that have to do, obviously, with a mental health issue. So what we know is that we have to pay a much greater amount of attention to the system and to collecting the right kind of information at the right time. And in order to do that, we also want to focus on the outcomes. What happens when the police actually show up? And what do we know about those interactions? So I will pass it now to my colleague, Marilyn, who will explore that question with us.
Thanks, Rebecca, for setting the stage so nicely for what I'm going to talk about. As Rebecca said, I'm going to present the results of some analysis that we did with the data that Rebecca was talking about that have to do with how well or how not so well computer-aided dispatch information collected by call takers and dispatchers relates to the resulting police activity on the ground. So that's the analysis that I'm going to present today. As Rebecca said, we really don't know much about this topic, despite the critical role that empirical evidence could potentially play in streamlining police resources and improving public safety. So our study worked closely with Camden and Tucson police departments to investigate these relationships. Next slide, please. We addressed 3 questions. The first 2 questions begin to address the issue of what do typical arrests even look like? The third question asks, how well does information gathered by call takers and dispatchers relate to whether or not an arrest takes place? So these questions all aim to help identify strengths in the system and where the process could potentially be improved. Next slide, please. To our knowledge, this is the first research that has merged, harmonized, and analyzed multiple sources of data from 2 large police departments. We obtained data for 2016 and 17 from 2 sources. First, the CAD system, which captures data collected by call takers and dispatchers. And second, the second source was the RMS system, which captures information on arrests, the outcome of interest in our study. In this very brief presentation, I'll give you a concise overview of our analytic strategy and a flavor of the results for Tucson. The pooled data for Tucson involved over 850,000 CAD events, which resulted in more than 87,000 arrests. Next slide, please. We took a 4-pronged analytic approach. First, we produced descriptive statistics about CAD events. Second, we conducted cluster analyses to create a taxonomy of arrest profiles, much like botanists do when they classify plants into species to try and understand similarities and differences. Third, we used mapping to examine the geographic distribution of arrests. And fourth, we use statistical models to estimate associations between CAD information and arrests. Next slide, please. First, descriptives. This particular descriptive chart shows that there are 2 main types of CAD events. There's 1 bar for each year here. The black sections of the bars indicate officer-initiated activity, while the red sections show 911 calls, the proportion of 911 calls for service from the public. The circumstances that motivate these 2 different categories probably are very different. For example, 911 calls potentially reflect the needs and perceptions of the public that might range from impulsive reactions. Somebody calls 911 out of the blue, or it might be a reaction to perceived threats, or it might even be a last resort for families facing circumstances beyond their control for which they need some external help. On the other hand, officer-initiated activities could be based on the expert knowledge of the officer's experience, or potential biases about when and how to intervene and diffuse situations. Next slide, please. Our second approach was to use cluster analysis to begin to get a handle on over 87,000 arrests in Tucson. The analysis produced 7 clusters shown in the 7 columns in this chart. And to give you a sense, just a sense of how this taxonomy works, let's look at the first cluster highlighted in yellow here. Starting from the top of the column, we see that the typical arrest in this cluster originated with an officer-initiated event. The arrest occurred at night in a predominantly white area of the city. It was a medium poverty area, and the person arrested was a white male, average age 52 years, considerably older than you might imagine. The other 6 profiles vary substantively, although they all involve males and none of them involve low poverty areas. Next slide. And I'm going to skip this one and go on to the next one, even in the interest of time. We also plotted the geographic distribution of arrests using GIS software by year. Each dot in these maps represents the location of an arrest, with the color of the dot indicating the race, ethnicity of the person arrested. The colors of the sectors on the map indicate the volume of CAT events, with darker colors representing larger call volumes. We can see immediately from 10,000 feet that most arrests occurred in the northern half of the city, that these arrests cluster by race. The purple dots indicate people who are arrested who are Hispanic, and the yellow dots, people who are white. Additionally, in certain sectors of Tucson, call volume increased from 2016 to 2017. For example, Sector 307 is orange in 2016 in the upper left, but it deepens to red in 2017 in the lower right. Next slide, please. Our fourth approach involved logistic regression models to examine the association between CAT information and arrests. All analyses controlled for sector level race, ethnicity, and poverty, as well as year. We stratified our analysis by call type. That is, we ran separate analyses for officer-initiated events and for 911 calls for service. Rather than walk you through this maze of odds ratios, I'm going to actually talk you through some findings about how incident type relates to arrest and the implications for policy and practice. The 850,000 CAT events were coded into 13 incident categories. That in itself was a feat. The comparison or reference category was violent crime. So let's take a look. Next slide, please. First, concerning incidents of domestic violence. For 911 calls, the odds of arrest were twice as great for domestic violence incidents than they were for violent crimes. For officer-initiated events, there was no statistically significant difference. Now, there are mandatory arrest protocols in effect in Tucson for domestic violence occurrences. Our results, therefore, suggest that mandatory arrests plays a much larger role in calls for service from the public than in officer-initiated events. Perhaps in the latter situation, officers have more opportunity to de-escalate tensions and divert from further justice system contact, but we can't say why. This finding needs further research, further investigation. Next slide, please. Concerning mental health and medical emergencies, these are calls that are near and dear to my research heart. For both types, for both 911 and officer-initiated events, the odds of arrest were lower for these incidents than for violent crimes. This is intuitive. This is what we would expect. It may be partly due to the role of Tucson's cutting edge and wonderful crisis response center, which provides alternatives to arrest and jail booking. However, a cautionary note, mental health advocates and many, there's strong feelings around that argue that the goal is to eliminate entirely arrests for these types of calls, that the appropriate response is community-based mental health and health services, which of course will require investments in these areas in community-based resources. Next slide, please. Finally, concerning non-criminal incidents. For 911 calls, the odds of arrest for such incidents were half as great as the odds of arrest for violent crime. That's great. The direction is as expected. However, for officer-initiated incidents, there was no statistically significant difference. Now, here's the issue. One might expect that non-criminal incidents would rarely result in arrest. Therefore, this finding, it might be just an artifact of coding. We need to code differently. But if not, it highlights the importance of continued efforts to improve communication between call takers and dispatchers and responding officers, so that officers are well prepared to de-escalate and divert non-criminal incidents from further involvement with the justice system. So this brief overview is intended to give you a sense of our analytic approach and some high-level findings. Next slide, please. In conclusion, we learned a tremendous amount from this project, working closely with police departments. There's much to build on in the future. For example, we can expand our geospatial analyses. We can incorporate data on charges. We haven't even begun to do that, and examine other outcomes such as uses of force and citations. On the other hand, the study revealed that there is a clear, pressing need for new, robust, standardized data. For example, we need to incorporate the experience of call takers and dispatchers concerning what data is necessary. It would also be useful to have information on disabilities of people, support systems they're involved with, social services in the area, and whether or not this is a repeat caller. These are just some examples. All of this will take systematic collaborative efforts to fund and coordinate new data collection initiatives. Next slide, please. So thank you very much, and I'll pass the baton on to Harold.
Thanks, Marilyn. Harold.
That's great. Boy, I'm itching to apply some of the tools I'm about to talk about to some of the data that you just discussed. So I want to talk about some of the work that we've been doing on that's been funded by the National Institutes of Mental Health in a recent R01, where we're trying to look at ways we could prevent 911 calls or identify when a 911 call occurs that it may involve a mental health or behavioral health crisis. Next slide, please. I should say that a lot of the work that's presented here, I've benefited greatly from collaboration of colleagues. The machine learning results in particular that I'm going to talk about come from collaborative work with Andrea Tentner, Zubin Zelba, and Xander Bieberman. But many other people have played a role in the work that we're doing, and very appreciative of my colleagues who've been part of this large team effort. Next, please. So I want to cover a couple of things in the next 3 hours of this 1 hour session. One is most of my talk is going to be really fairly technical, talking about some of the machine learning approaches that we use and how they compare to other approaches that we might use to identify individuals in behavioral crisis when a call occurs. But before I get to that, I want to give sort of the mundane realities that both Marilyn and Rebecca were speaking to. I want to give those their due. So I hope that we can have a broader discussion after my talk is done that incorporates all three of our presentations. Next, please. So, one of the things that's really striking is everyone that's involved in this space, and I know, Jennifer Wood is on this panel, is one of the most prominent experts on CIT. Many of us understand the basic principles of how we want first responders to act when they go to a call that might involve someone who has some sort of a behavioral crisis. And one thing that is very clear in these calls is people often show up and really are not in a position to understand exactly what's going on. I mean, the Tamir Rice story is the most tragic one, where he is a toy guy, but there's many, many times when police or fire will show up and someone is behaviorally dysregulated, and you just cannot really fully determine what's going on, and you have to respond in a humane and effective way that keeps everyone safe in the situation, without the ability to really fully unpack what's causing the crisis. And I think everyone understands that the time and distance and cover principles in CIT is really critical for police officers when there might be a possibility of escalating into violence. Give the person time to calm down, gives you time to get other people to help you, keep your physical distance with the individual, use cover as required. If you try to understand when are these principles effectively applied, the mundane realities of police work often play a huge role. And I was on something called the Police Accountability Task Force in Chicago, and I saw Walter Katz is in the audience today, so he's certainly quite familiar with what I'm about to say. But we were trying to understand how could we help officers in Chicago de-escalate more effectively. And one of the things that we found when we talked to officers was very often sort of very basic things make a huge difference. How busy are you? So, if it's 2 o'clock in the afternoon and you're in a low crime area of Chicago and there's a gentleman standing in the middle of the street having a loud argument with Jesus, police are actually quite humane in responding to that uh, in a way that's much more difficult to do if it's uh, when they're more stressed for time. So one of the officers told us a story about how she got a call that there was a gentleman sitting on his couch, and he needed to go to a mental health facility, and it was a Saturday night in Englewood, which is a area of Chicago where there were a lot of police calls, and she's really calming the person down and talking to him and having a really nice relationship that's developing. But while she's doing that, her cell phone is just going nuts, and her supervisor who's standing behind her, his cell phone is going nuts, saying there's a shooting here, there's a, we need you to go to this other call, and at some point her supervisor runs past her, tackles the man and says, I'm sorry, I just didn't have the time to, I had to wrap this up, and we're just needed at other emergencies. And so we have to give the mundane realities of 911 work their due. When officers take someone to a location, what will actually happen if they take someone to the ER? Will they see that person 2 hours later, after they've left AMA, things like that. So I must say that when in a lot of our work, I have become very sympathetic to just how the realities of police work can make it very difficult for people to do the things that they want to do. And we could talk about that maybe in the questions and answers. Next, please. So now onto the administrative data. So we analyzed in Chicago a very large amount of 911 call data, where we identified who are the high users of 911 services. By the way, it was an interesting, Chicago's a big city. It has 2.7 million people in it. One of the humorous aspects of our work was that when we really started talking about some of the high users, and we would go and talk to people in the fire department, the police department, and we would take a case and we would disguise it and we would start talking about it. And then someone in the audience would say, isn't that guy on the blue line who wears the red jacket, who's like always talking about the White Sox and what happened? And it turns out that there's not that many people, even in a big city the size of Chicago. And it was really striking how much our city partners had a tactile sense of the actual humans that we're talking about. Next, please. So for those that are interested, we published in the American Journal of Public Health with Andrea Tentner as the first author. We looked at who were the real high users of police-involved emergency services, where police were there and there was an indication that this was a behavioral health situation, and we identified people, places, and events where such calls were especially likely to occur. Next, please. And one of the things that we've talked about a lot here in Chicago and elsewhere is services that might be focused on individuals who you could identify as frequent users of services, sort of high user models. We used to use the term frequent flyer. I think a lot of people find that term inappropriate, and I do as well. So I would say the people who come into frequent contact with the 911 system. And there's certainly tremendous value in identifying some of those individuals and seeing how we can serve them. But there are real limits to these high user models as well. One limitation is that many people have a period of high use that self-resolves. And so sometimes you're focusing services on people who no longer need them by the time you identify them as high users. Conversely, high users have very distinctive needs, very idiosyncratic needs that may not match available interventions. We often think, oh, this person must require assertive community treatment, or this person must require some other type of service. There's lots of reasons why people can have frequent contacts with 911 that are very different. Also, just focusing on counting people's encounters with 911 does not take very much advantage of the rich data that we often have about these individuals, why these calls are occurring, and aspects of the situation, people, places, and events that can be very helpful for interventions. So we tried to use machine learning to provide us a different approach to doing this. And I should thank the Arnold Foundation for supporting a lot of our work on something called the MHeart project, which I'm happy to talk about, although I won't have time today to say much about that intervention. So I'll show you in a minute a couple of slides about our predictive analytic work. So next slide, please. So what we are doing is we are doing machine learning analyses, and as in Marilyn's case, the particular data set I'm talking about right now comes from 2016-17. What we did is we used 1 year of data from May 2016 to the end of April 2017 as our training period, and then we used that to predict outcomes for the following 6 months. And we developed what's called a random forest classifier that had about 400 features associated with it. And one of the striking things about this work, as many of you know, is you think going in as a professor at the University of Chicago, you're going to spend most of your time writing X's and betas on the blackboard and having lots of calculus all over the place. And what you actually spend all your time on is A, getting the data use agreements and honoring them with your partners, and B, seeing data that says James Johnson and Jim Jones were both arrested on the red line in April. Is that the same guy? And how many different ways can you misspell the word homeless? And how do I think about the real world data generation process that gave us these data? And I'm happy to talk about that as we move on. But so we analyzed 143,000 unique individuals who had at least one encounter with police or ambulance services. And we looked at how effective were we at identifying individuals at risk for a behavioral involved police encounter? And then we performed a variety of experiments and looked at different subpopulations to understand how well we would do. One of the things that I should mention that we think is important is we also perform what we call leave-out experiments. So for ethical reasons, legal reasons, administrative reasons, some of the variables that might pop out of a predictive analytic model can be problematic. Do you really want to use arrest data all the time when someone makes a when there's a 911 call that does not involve any threat of violence? There's a good argument that says it's really not appropriate to look at the person's arrest record for when a 911 call comes in because they're sick, or race variables, things like that will come, will pop into the model. And obviously there are reasons why those can be problematic. So we perform a variety of leave-out experiments where we see what happens when we remove variables from the model that might face these kinds of constraints. Next, please. Can you advance the slides, please? So I'll just quickly, I just have a quick wrap up. One is we compared what we get out of a High-vser model with what we get from a really more elaborated machine learning model. And we found a couple of things. One is we found that an actual High-vser model worked surprisingly well when you were looking for a really small group of people. If you said, I want to find 143 people in Chicago that I really want to focus intense services on, who are the highest, I predict are sort of super high need for interventions. Turns out the High-vser model does almost as well as a really sophisticated machine learning model to try to find that subpopulation. As we enlarge the group of people we're interested in, suppose we have an intervention that's looking at the top 5% of people in Chicago in terms of risk. Maybe we have an intervention in an emergency department when someone shows up that we could focus on the top 5%. It turns out that the machine learning model gives us much better precision than just a High-vser model would give us. Next slide, please. So it was very interesting when we tried to compare the strengths and weaknesses of these two approaches. The High-vser model worked really well if we were looking for a simple model that was very transparent and that could identify a small, really high-risk group of people for interventions. But we also found some real problems with the High-vser model. One is that we would flag individuals who sometimes would self-resolve. And also, of course, if you're trying to do preventive interventions, the high user model by definition is not preventive. Someone already has had a series of things happening that require 911 calls. So if you're looking for people that you could serve before these crises happen, that of course, that approach does not work. And finally, many of our high users that we identified didn't match particularly our available interventions. So next slide, please. So when we looked at the strengths of our machine learning models, what we found is they provided better flexibility when we were looking for larger populations. They were better at finding people who were going to continue to have crises rather than things that self-resolve. And we also found that we could identify people both who had a variety of issues that showed up in our data before a crisis occurred. We also found when we looked at some of the particular features that jumped out of our machine learning model, we did find that there were certain characteristics when people did have an incident with first responders that were very predictive. Housing instability, aggression, various markers for behavioral health disorders. We did find we learned a lot from the features that were jumping out when we did the machine learning analysis. Next, please. This is my thank you slide. And I'm sure that Rebecca's saying thank you because I'm stopping talking now. Thank you, everybody.
That was great. Thank you, Harold. Thank you, Marilyn. And I'm sensitive to the fact that we have just a couple of minutes before a hard stop for the panel. So I really want to encourage everyone to engage with us and the larger conference community through the High-vser community board, and we can exchange contact information and questions that way. But we do have time for a couple of questions, and I want to turn first to comment that Carl shared in the chat bar in regards to your anecdote, Harold, with officers dealing with the man on the couch and the sergeant's actions playing to exaggerated narratives of the need to race around, solving crimes, getting to shooting in a hurry after the fact. And I just want to highlight here and then invite Harold and Marilyn to comment. I think that we have, unfortunately, basically created a performance management system for the 911 operations in this country that completely functions around response time. We want everything to be handled quickly. But in reality, and the reason why we demonstrated that the vast majority of calls don't involve an emergency that's in progress, is that these calls are not going to be adequately responded to through a quick response. And in fact, they may be aggravated, particularly with individuals who are in crisis. So we really need to focus on sending the right responder at the right time and incentivizing people and training them in order to ensure that those outcomes are best achieved. A quick response most often is not the best response. And Harold, Marilyn, would you like to build off of that?
Marilyn's in a better position to field that one in a way than I am. Although she may not be if she's muted. You're still muted.
Yeah, yeah, I think, you know, we've all heard the story. There's just so many stories around about, you know, what the best kind of response is to these situations that may be critical or may not be critical, but involve people with mental illness of some sort or another. And, you know, there's stories about how when people hear the sirens coming, that really intensifies the situation and raises it to another level. So I don't really have anything to add, except I think this is a very important point, and a lot of work needs to be done in really thinking about what is the responsibility, where is the response to mental health crisis best placed, who should be first, who should be second, and what is the role of the police.
Let me add one thing to that, which is also that one of the challenges is we also want people to feel comfortable calling, you know, so my wife and I take care of her brother. He lives with something called Fragile X syndrome, which is an intellectual disability. And about a third of the caregivers for young men with Fragile X report that they're regularly injured by their sons. And one of the things that people often talk about in things like Facebook groups or whatever is, I'm never going to call 911 because I'm afraid that they're going to come and they're going to hurt my loved one. And so you have these moms who are 62 years old who are living with their 28-year-old son, and they're actually made less safe by aggressive police practices because they're not going to call the police when they need someone to come. They're not going to use 911. And so we often think we're keeping people safest if the police have the most aggressive response when someone might be in a crisis. And that leaves out of the equation all of the other people in the system who need to feel confident to call on this resource when they need it. And that is, and I think that just underscores the importance of the point that Marilyn is making. Someone has a call where police come very rapidly and then behave in a way that the family regards as harmful. They're just not going to call again.
Yeah, and we've seen similar things occur in communities of color when there have been inappropriate uses of force in which 911 calls precipitously drop. And we also know that many communities will not call 911 under any circumstances. Much of the crime in this country is in the United States is not reported, including serious violent crime. So there are core procedural justice and legitimacy issues here. And we definitely see that there has been a real absence of that voice. And I appreciate an anonymous attendee actually just spoke about how has community voice and expertise been integrated into the quantitative analysis process, and are there examples of this type of collaboration on any of these projects? Maybe I'll ask Harold if you want to respond to that quickly. And then I think we have 2 minutes before we have to close the panel.
There's two ways. One is that we have complementary qualitative analyses that we are doing with the quantitative ones, but we brief our partners and we show them, we ask them about our findings and how we should interpret them, and we ask them for hypotheses that they think should be tested. And in the case of our some of the interventions that we've done based on this machine learning work, we've worked closely with NAMI and Thresholds and others to try to bring those voices in.
Thank you, Harold. I'm sensitive to the time. I know we have a very hard stop. Thank you so much, everyone, for joining us today. We look forward to continued conversations. A big thank you to all of our research collaborators on this work. This was not done alone. We appreciate all of your contributions. And a major thank you also to Arnold Ventures and other funders who have supported this work, and to the police departments and public safety communications partners who have opened their doors to have these critical assessments. Thank you all. I hope you have a wonderful day.